Are you there, Dr. Hunton?
Yes, I am. I'm here.
Hi, I just want to give you an intro here. Dr. Hunton is, of course, a doctor, and she's the owner of Radiantly Healthy MD with locations in Vieira and India Atlantic. Dr. Hunton combines traditional medicine with natural options to help her patients return to health and vitality. And I hear, Dr. Hunton, you will be also a speaker at this year's 12th Annual Healthy Living Expos, being held March 8th at the FIT Clemente Center in Melbourne. How do you feel about that? Congratulations.
I'm excited. It's a wonderful event. If you've never been, I would put it on the calendar to go. They usually have about 2,000, 2,500 people attend and a huge exhibit hall. If you're into the freebies, get there early because there's a lot of the exhibitors have free things as you walk through the door. And then if you want to avoid the crowds, I guess come a little later. But I've been a part of this event for several years. Fantastic event in the community.
And what are you going to be speaking about?
We're going to be talking about personal genomics and healthcare. We're starting to have a shift in how we look at taking care of us humans. We used to do these experiments, or we kind of still do, on a very large group, and if it worked for the majority of people, it became the protocol that we followed. Now we're starting to look more at those outliers, or what makes you different from me, and why maybe not following the cookbook might be in your best interest. So we're looking at some of the genes that we've got more studies about and how it impacts health.
Is that part of the Human Genome Project that you're speaking
about? A lot
about?
of the research is coming out of that, absolutely.
And can you explain that to our listeners, what the Human Genome Project is and what that's all about?
Well, they've been, there was a big push to map the entire human genome. And it's huge, and they've got it all mapped out. Now the trick is figuring out what the map means and how it impacts our health and our future generations. And the more we learn, the more we realize we don't know, and which is kind of cool. And just having your genes doesn't mean it's destiny. So, there's people who carry the genes for blue eyes, but they actually have brown eyes, so something from as simple to that to, you could have the gene for Alzheimer's, but not necessarily be destined to get Alzheimer's, depending on your lifestyle habits and patterns. So I find it very exciting looking at individuals instead of the humans as a herd.
Right. And can you tell me a little bit about your practice, what makes your practice different than the average medical practice? I know you do integration, you do average traditional medicine, and also natural. You work with natural things.
Yeah, I do. It's kind of evolved over the last 10 to 15 years that I've been in medicine, the approach that I take right now. And the official board certification, as Western doctors, we're all about the diplomas and certifications, has been recognized as the American Board of Integrative Health and Medicine. So that's now an official board certification as of last year. So, I use the word integrative, I think, a little bit more now than any of the other terms. But it's really looking at health and restoring health instead of just necessarily band-aiding disease. My practice is a little different because we spend a lot of time with the patients, and we talk about how to fix things naturally if we have the time to do so. But because I am an MD, I'm able to write prescriptions if we need those and to order testing when it's necessary. So it really is kind of the best of both worlds.
Right. Can you give me an example of what you might do for a patient that suffers from chronic fatigue syndrome? How you would combine that with traditional medicine and natural?
Yeah, so chronic fatigue is quite, the enigma. It's really a description of symptoms, not necessarily a diagnosis. If you went to the doctor and were told that you had a fever, you wouldn't necessarily be happy with that. No. But if you get told that you have the strep, in your throat and you get an antibiotic, then you feel like you've had a resolution. So many people who are diagnosed or labeled chronic fatigue, that's really a symptom. And we really want to figure out the why behind it.
Right. You don't want to just put a Band-Aid on it. right? You don't want to
Correct.
just put the Band-Aid on. You want to get to the actual causes of why.
Correct. And so there's a lot of different whys for chronic fatigue. It can be something, there's a patient in the practice with a mitochondrial disorder that wasn't diagnosed until adulthood, to chronic infections, malnutrition. Some of us are very overweight or not necessarily looking undernourished, but our ability to absorb our nutrients is impaired by things going on in our gut, or perhaps we are just basically choosing the standard American diet without a whole lot of nutrition in it.
I mean, I know there's a lot of things. There's a lot of things that originate from disorders in the gut. We're going to be coming up on a break pretty shortly here, but if you can stay on the line, and we'll continue with you after the break. This is Nancy Kenny, and you're listening to the Nancy Kenny Show right here on the Talk to Me station, AM 1300 WMEL, and we will be back. Right now, we've been talking to, before the break, with Dr. Rebecca Hunton of Radiantly Healthy MD, and we've been talking about different illnesses. Are you there, Dr. Hunton?
I am, Nancy.
Okay. Can you tell us a little bit about what metabolic syndrome is, and some of the signs and symptoms of a thyroid disorder?
So I'll start with the metabolic syndrome. Metabolic syndrome is a cohesive group of illnesses that tend to occur together and fundamentally stem from the same cause, though in Western medicine we often treat them separately. That's diabetes, high cholesterol, hypertension, and renal dysfunction. But they all kind of come from a root cause instead of being each individually a separate entity. So when we look at metabolic syndrome, we want to re-regulate the blood sugar balance. We want to re-regulate the lipids, which kind of leads me to the thyroid.
Right.
Thyroid disorders. Thyroid, one of its number one jobs that most people don't think about is regulating our cholesterol. And so when thyroid is out of balance, we're going to trigger into some of those metabolic syndrome traits without it really maybe even being metabolic syndrome as the underlying genetic cause.
Wow. And what are some of the best ways that you find to treat those? Is it always somebody has to go on the thyroid medication?
Well, with thyroid disorders, no, not necessarily. There's a lot of, 100 years ago, the United States was low in iodine. So back then we added iodine to salt because everybody ate salt. And then about the 1970s, we started telling everybody, stay away from salt. And so the iodized salt kind of went to the wayside, and today, if people do eat salt, they're getting Himalayan pink sea salt or Mediterranean sea salt, not necessarily getting their iodine anymore. On another level, we fluoridated our water. We use brominated flours and stuff in a lot of our processed foods. We use bromide as a preservative, and when that happens, we displace the iodine from our body again. So you take a predisposition already, just being American, to having low iodine, and throw the other things on there, and the thyroid can start to struggle because every thyroid molecule requires 4 iodines. So sometimes it's easy by just replacing iodine and selenium and a couple of the other nutrients in the diet, and you get the thyroid functioning just fine.
And isn't it true a lot of times with some of these illnesses, it's best to take some of these vitamins maybe together? They all kind of work together as almost like a team?
That's true. That's true. And on the other hand, if you focus only on one piece of the body, for example, people come in and they'll say, well, I'm not eating any of the cruciferous vegetables because I've got a thyroid disorder. Well, there's other things in your body that require the nutrients that are in those foods. So
and let's remind people what the cruciferous vegetables are, like broccoli.
Asparagus, Brussels sprouts, broccoli, the ones that kind of are a little smelly, but they're required to, like, for example, for women, to help metabolize the estrogen safely out of their body. So if you become all about just one part of your health, then you're going to usually suffer in another area. You got to
Right.
really look at the whole
Because
person.
everything is connected. So you're talking about as a holistic view.
Yes, absolutely.
I read something interesting, too, that you offer IV vitamin therapy. Can you tell us a little bit about that?
Yeah, it's kind of catching on in Hollywood in the last few years. When we use nutritional vitamins, like high-dose vitamin C, the B vitamins, some of the minerals, we can get to the tissues directly and saturate them and get them functioning optimally. So I mentioned Hollywood, or even Miami. There's little groups that go around and give these IVs after somebody's had a big night of partying to kind of reverse the hangover really fast. That's not my goal.
No.
I'm really looking at, a lot of us we're not deficient, but maybe we're not optimal on a lot of the nutrients, or maybe there's something going on in our guts where we're not able to absorb the things the way we're supposed to. So by using the IVs, we can bypass the gut and get the body systems functioning better, faster.
Interesting. And what kind of vitamins do you usually do in the IV? I'm assuming probably the B vitamins for sure.
B vitamins, vitamin C is huge. There's actually some research out of the University of Florida using IV vitamin C and plastic surgery patients, breast augmentation, and facial plastic surgery showing faster healing, less infection, less scarring. So there's research in doing it in different disease processes, or even just in optimizing your healing.
Great.
So I think it's pretty cool, but primarily it's those, and then we also, zinc, magnesium, calcium, potassium. I really kind of start with the labs and the person's health issues, and medications can deplete nutrients from you as well, to kind of come up with a formula.
Right. Well, we're coming up to the end of this segment, and I'd like to invite you to come back on a future show to talk more about some of the different things that you offer. I appreciate you calling in today, and good luck on your speech at this year's upcoming Healthy Living Expo, and have a great day.
Well, thank you so much for inviting me to be here. I really appreciate it, and I do want to plug that expo. It's, the biggest one in our community, and if you've never been, it's so informative. It's such a wonderful thing.
Yeah, and can you tell us when it is and where?
It is, I'm right here by the poster in the office, Sunday, March 8th, 2015, from 11 to 5:30 p.m., and there's free things for the first 500 attendees.
It sounds.
It's at the FIT Clemente Center.
Okay, and it's also free, right?
Yeah.
That's always good. Well, thanks for joining us today, and have a great day. Thank you.
You too. Have a good day.
Thank you so much.